Hi, I'm Brad. I'm your student nurse. Looks like we got a doctor's order to do a blood draw on your central line here. Let me wash my hands really quick, and then I want to get your full name, please, and your date of birth. Okay. I'm going to check your wristband here in just a second. After I get my hands washed for 30 seconds, so they're nice and clean. Okay, full name and date of birth. Check your wristband really quick. Hi, Sinlab Susie, how you doing today? Like I said, it looks like we have a doctor's order to do a blood draw. We're going to change your dressing and do a cap change on your central line here and clean it up a little bit. Let's see. I want to make sure that you understand what we're doing. So could you tell me back? Could you explain back to me what I just explained to you? Okay, great. Let's see. Okay. I touched the patient, so I'm probably going to rewash my hands just to make sure I don't got any germs for 30 seconds. Then we're going to get ready. Get some PPE on. Glove up. Get ready to do this. See if I can do this on my own this time. I'd probably check the patient for any allergies to any medications just to be safe. Latex allergy, any medication allergies. And we're going to change this dressing every time that you get a blood draw. You'll be getting a dressing change and a cap change. Or if we notice that it gets dirty, we can change it as needed. Otherwise, we'll change it every 7 days. If you were getting a lipid feeding through the tube, then we would change it every 96 hours. But you're not doing that, so. Okay, we're going to place the patient in the supine position. I'm going to place the mask over the patient's mouth and have the patient turn your head to the side. And this is going to be a sterile procedure once we get the dressing off. This is going to be a sterile procedure, and you can't try to hold as still as possible. And don't touch anything if you could, please, because you could contaminate it, and then we could get germs on the sterile stuff. So, okay. We provided for privacy, patient supine, hands are washed, and blown up. I got all my equipment set out here. Should have went over that before I put my gloves on, but I got a pretty flushed new cap with NS, with 10 milliliters of NS. I got 5 milliliters of heparin. I got 2 other 10 milliliters of NS and 2 empty syringes for the blood, one for waste and one for blood. I got the needle for the vacuum container. I got the vacuum container. I got my sterile gloves. Assistant?
Yes, sir.
you come over here and put my cap back on my sterile thing
Of course.
that was never taken care of, that was always on there the whole time. Thank you. And I got my alcohol wipes. So the first thing we're going to do is take off the old dressing. So we're going to use an alcohol wipe here. Will help loosen it up a little bit. Make it more slick, one or the other. Make sure to pull away. Do not pull on the Okay, as we're doing this, we're going to check for signs of infection. We're going to check for patency, make sure that it's still in place. Ungloved. If there was blood, we would, or anything oozing out of the site, we're going to send it off for culture. So I'm going to wash my hands again for 30 seconds. I'm going to re-glove. And we're going to set up our sterile field. Gloves. We're going to carefully open this, not to reach over the sterile field, and only grab it on the 1-inch border. Let's see. Gloves on. Oh, that was much smoother than last time. Alright, now. Sweet. I hope that will. Go ahead and get rid of this. Okay, we got the mask, which is going to be already on the patient. The drape, which we would lay on the patient's chest. We got the chlorhexidine, which we're going to go ahead and use right now. Crack it open. I can grab the line. I'm going to scrub all around, back and forth, all the way around it. Make sure I get it really good. Back and forth, back and forth, back and forth. Then we're going to work on the line. Make sure we get the line where the dressing is going to go over. Get that really good. Okay, next we got our alcohol swab. I'm going to pick up. I'm going to tear with this side. My contaminated hand. Without dropping my hands below my waist. Flip it over. And I have my alcohol wipe here. I can stabilize the line, and then I'm going to clean up any blood. This will get the blood off that's on the line. Okay, now we're ready for the dressing. So the dressing is clean on the edges. The dressing is considered dirty on all the edges, so I can grab it with my dirty hand, as long as I don't contaminate. Just on the edges. We're going to apply that right directly over the site. Well, now that we're done with our sterile field, I can touch the outside of this thing. But getting it off might be a different story. Wow. That sucks. What the heck? Dude, come on. Of course I would not be ripping on the patient's skin like this, but for some reason this is stuck. Minor setback, but I think we've resolved it. Of course, I would never pick on the patient's skin like that. Okay, so next we're going to do the blood draw. If the patient had anything infusing through this, we're going to shut it off 2 minutes prior to doing this. And we got it clamped. We're going to remove the tape. We're going to open an alcohol or two. Scrub the port for 15 seconds. Okay, we're going to flush with NS using positive pressure after we're going to clamp. We're going to clamp it when we get to the last half C. That can go in the garbage. Then we're going to attach our empty syringe. We're going to withdraw 5 cc's. Clamp our syringe, or clamp our clamp. That'll go in the sharps container. Got our other empty syringe. We'll attach. This is for our blood. It says to withdraw. The doctor ordered 5 cc's. So we're going to go ahead and pull out the 5 cc's, or the 5 milliliters. Clamp our syringe, or clamp our clamp. Attach our needle. Ready to go. The vacuum container should theoretically suck this in. It should suck it. So the vacuum container would have sucked it in, right? I'm going to pull that out. That can go in the sharps container over there. We're going to agitate this. And then we're going to put the patient's name, time, date, my initials. Send that off to the lab ASAP. I don't know if I verbalized that I would put my name and date and the initials on the dressing, but I would have. Okay, so we got the blood. We're going to clean the port again. We're going to flush with 10 cc's. Open the clamp. Positive pressure. Clamp it on the last half cc. Pull that off. And go over and surface tube. Okay, now we're going to do the cap change. We're going to swab the bottom of the port here. For 15 seconds. We got our pre-flushed cap ready to go. "15 seconds. Remove the old cap. Touch the new one. We're going to open our clamp and we're going to flush the 10 cc's. Clamp on the last half cc. Like that. And then we're going to do the heparin. Same thing. Unclamp. Flush. Clamp on the last half cc. That's good. And then we're going to attach to the patient's chest. Now I'm going to teach the patient about hand hygiene, not touching this as much as humanly possible. Try to avoid touching it. Covering their mouth when they cough. We don't want any germs to get on this thing, on the port or any of that. And I'm going to address the patient's needs. Are you comfortable? Probably un-PPE. Make sure the patient is comfortable. Here's your call light. I'm going to wash my hands when I leave the room, and I'm going to document. That's it.